So this is my on-call notebook. My name is Chloe Mogul, and this is my assignment for the cognitive linguistics class. The first page just talks about how these activities are all culturally appropriate. Then the first tab I did was orientation. Orientation is one of the cognitive domains that we talked about in class. The SLUMS exam is a really great exam. It does have a few orientation questions, but it also addresses, other areas of other cognitive domains. But because it does address orientation, I did include it in this section. This is my orientation activity for someone who would be considered severely impaired. It's just entailing that they look out the window and they tell the therapist what season it is, and then they have the options here and can point to which season it is. So they have several aids to help them with this question. This activity is the daily logbook. The patients basically write down what they did each session, any visitors, their thoughts and feelings, who was there within the session, and then they kind of review their entries. It's almost like a diary of their therapy sessions, remind them of what's going on and who's been around. So they can also record not just their therapy sessions, but when they have people visit, and just anything that happened within their day. This activity is called the O-Log worksheet. Before doing this activity, you can show them a calendar and some other memory aids, and then you practice essentially calendaring, which is filling out a blank calendar, crossing off the days that have passed, writing any significant holidays, hospital-related days, such as there's any surgery scheduled, therapies, and then you ask questions about it. So for example, how long until the next holiday? These are a few other orientation questions. This activity actually has you have the patient go on a walk and find ways to answer certain orientation questions, like where are we? And they can look within the hallway and look to see a sign, like in which hallway they are in. So this is a nice orientation activity. This one's just asking which month it is. So the patient can select the option provided, one of the options provided there. This one's just asking what day of the week it is. This one's asking what time of the day, and there's pictures provided that are clues. The patient could also look out the window for this activity. And then this is just a simple patient information form, having them fill it out and review it each session, their name, their birthday, address, city, state, zip code. All important information that they should know. This one's really nice, and I've been able to use it in my sessions with my externship. This is just an entire sheet of orientation questions, and what you can do is you can put a date up here and ask them for several days and kind of monitor their progress. For one of my patients, we've actually saw progress the next day. He was able to remember the state he was in, the city he was in. So that was really cool to see. So this asks a few different questions than the other ones I had in my section. Do you have any children? What's your doctor's name? What's your room number? Very important questions. This orientation activity asks the student how much time has passed since specific events have occurred. So you're talking about things that happened a few hours ago, months ago, etc. And you kind of develop a timeline of the events. This one is helping the patient with an organizer and one with an alarm function on it. So this orientation activity does include some other areas, memory, problem-solving skills, as do a lot of some of these activities. So basically you're having the patient learn how to use whatever it is, whether it's a smartphone calendar app, and you're helping them use those alarms. I use alarms all the time for assignments. I schedule it a day out, a week out, an hour before, so that I'm constantly reminded of when things are due. That just helps me. But for patients, I know it says students on here, but for patients in a skilled nursing facility, it can help with medication time, when they're living at home, and help with medication times and daily routines and certain schedules. This activity is providing a memory notebook, and you're asking questions about this notebook. They should be keeping like a schedule, a daily schedule, and a notebook of what things they have done for that week or that day. And this one is just asking what date will be tomorrow, next week, what will be in 5 days, what was 5 days ago. So you can allow them to refer to the calendar. This one's kind of going off the memory notebook, but you're making sure that there's important telephone numbers and family, friends, and names on it. You're kind of asking them questions about the notebook and making sure that they have everything in there and are able to respond to questions like, what time are you supposed to do your worksheets? And they have to go through and actually use their notebook, what they made, to answer those questions. The next section is attention. This exam is something my supervisor uses. It has 3 sections for attention, but as you can see, it also measures memory, fluency, and I believe a few other things, visuospatial skills. So it's an overall cognitive exam, but I put in the attention section since it has several sections for attention. So this is an activity for severely impaired. For attention, I actually used this with one of the patients at the externship. So she had to sort a deck of cards by color. So putting all the red cards in a pile and then black cards. And then she had to do it by suits. And I had to time the task because her goal was to have increase her attention by 1 to 3 minutes. And she actually did really well with this activity and was able to keep her attention, which was great. So during the examination, she had a hard time with attention, and so it's kind of interesting. There were less distractions during this activity as opposed to the exam. Unfortunately, we had a few people come in and interrupt the session. There was some background noise. So yeah, so we probably will have to up that goal for attention time, or just continue to monitor that. So, because she did much better than during her exam. All right, so this one is also attention. Addition requires concentration and attention to the problems in order to compute them correctly. Word searches are great for attention. I love word searches. And then we have some bigger ones in here, and you can see the words relate to their setting. So the hospital, nurse, therapy room, all words they have to use. And then it gets a little bit more complicated. So this is for a more advanced, obviously, not as impaired patient. So we have crossword puzzle here. Another one. This one's a little bit more simpler. This one is visual scanning. So they have to find all the B's. So that definitely requires their attention to look through all of those rows to find letters, and this one is numbers. And then here's some subtraction. So again, very simple subtraction problems, but we're focusing on the attention. And this one is locating the words within the puzzle and then writing them down. Same with this one. So another word search, and those are just, looks like some sports there, so a category. All right, now we're in the memory section. So for the memory, I chose, the RIPA-G. This test has several areas of memory. As you can see here, it's testing immediate memory, recent memory, and then again, like a lot of examinations, it examines more than one cognitive domain. So it does also have some orientation questions, reasoning, problem solving, etc. Here's an activity for the severely impaired. It just kind of has some pictures of some daily items for teens and adults. I wouldn't probably use all of these pictures because I'm not sure of many adults. May not be everybody that would use a flash drive or a USB drive, but some of them would be more daily items. So basically, you would just have the SLP would name an item, show its picture, and then the SLP will remove the picture and ask after 30 seconds what was the picture of. And obviously, you can do more than 30 seconds. It just kind of depends on where the client's level of memory, I guess, and attention is. So this is having the client remember the paired words that the speech therapist would teach them. So for screen, we would have TV. So it's practicing these associations, and then we would assist, the clinician would assist by explaining the relationship of those two items. This one is remembering to follow directions. So it's having them like underline things, circle, draw. So that could also go for visual spatial. So again, some of these activities, you know, have work on multiple cognitive domains. This one with memory is reading a list of words and then having them remember like the third word, the word after theater. This one is remembering sentences, so they have to repeat it back. And then this one is just answering questions from a paragraph. These are yes or no questions, general information of memory. So can they remember that, you know, there are 16 ounces in 1 pound? And then here's some more general information activities, but this one deals with food and drink. This one's occupations. These ones are just general memory questions, like who was George Washington, and some other questions like what is a computer? All right, visual spatial section. So for visual spatial, I chose the MoCA, or the Montreal Cognitive Assessment. I've actually given this assessment before, and the top is definitely the area of the visual spatial / executive functioning. So it really has them follow this pattern of letter, number, letter in ascending order. So you have to go to A to 1 and 1 to B and B to 2. Yeah, so, or excuse me, 1A, A2, to then 2 to B. So this task can be a little complicated for some of those severely impaired patients. And then they actually have to copy the 3D shape. And then the other visual spatial task is to draw a clock and set the time for 10 past 9. So again, it measures some other areas, some other cognitive domains, but it does include a section on visual spatial. Here's another exam that Dr. Neil Stringis provided us, and this one is definitely about visual spatial. It has you draw a circle, a cube, a square, many other common items like a house, a tree. This one is for patients who have right hemisphere stroke. And so typically those patients have difficulty with visual spatial skills and some other areas. So you can see here there's a huge area of visual spatial skills that that are tested in that exam. Here's my severely impaired patient activity. It's just deciding which letter does not belong in the set. So they should be able to see that, you know, there are 3 of the same letter and there's one that doesn't belong, and then actually crossing out the one that doesn't belong. This one is more advanced. You're drawing a line between the letters in alphabetical order. This one can also be for patients with left neglect. It has them actually write the sentence on the left-hand side and line up I guess their starting point and their letters there. So this one is a nice activity for that, but it's also visual spatial because they have to write it within the line and with decent spacing and everything, appropriate spacing. And this one is kind of similar, but it's creating a list. So this would help people, you know, write their grocery list legibly and practice doing that. Or just writing lists in general, like a to-do list. This one is spelling the letters and drawing the lines until you have spelled the word. So again, visual spatial. This one is kind of nice. It has them practice letter writing, but they have to make the letter the appropriate size and follow the spacing within the boxes. So it kind of gives a grid to help with that. And then this one is shapes. Now this one is a little actually a bit easier than the other ones because my supervisor explained it doesn't have so much basically visual or writing. So like this sometimes would confuse patients because there is just so much there. ABC, 1, 2, 3, lots of lines. So this one is just can actually be more helpful for patients. And this could even be used for severely impaired. This one's really nice too. So basically mazes, which are visual spatial, they have to try to stay, you know, within the lines and go from left to right. So again, good for left neglect patients. So even right neglect, because they got to get to the other side. So having them make sure that they are looking at that side and able to go all the way through and don't stop in the middle. This one is also copying drawings. And this one is drawing the lines, drawing a line through the middle of each. So again, visual spatial. All right, and the last section I have is executive functioning. So I used the functional assessment of verbal reasoning and executive strategies. Here's my severely impaired activity. This one would be putting the days of the week in order. So I think I would actually probably cut these out for the patient and have them organize them and put them in order. So it's good for severely impaired because they're provided with the answer options. They don't have to write it or speak it off the top of their head. And then also some, you know, cues could be given, like the therapist could give, could help and give them the first word of the week, day of the week in order, and then have them go from there. So a nice activity. This one is putting the months of the year in order. And again, you could also cut this up and have them rearrange it in order, like on the table. This one's really nice. I like this one a lot because it is very functional. It's having a budget of $40 and going through and seeing and adding up the groceries and seeing if you were over budget or under budget. So very helpful for those patients that are going to be, you know, leaving the skilled nursing facility and going home and living more independent. This one's nice too. Balancing a checkbook, writing addresses, writing letters, addressing envelopes, filling out checks, like I said. So really good practice with all that stuff. This one is temporal awareness, so they do have to write in numbers and clock hands for the times indicated. So this one can also be considered visual spatial. but knowing what time it is and being able to put that on paper. This one is definitely more executive functioning with what time do you do this, what time do you have this. And here's some more questions about time. These are great too. Cooking a meal. So they need to list all the steps that are in order. So there's that planning and organizing and ordering and sequencing things. I really like this one. Daily skills. Describe how you would do the following tasks. So again, planning. How would you do the laundry? Really great functional stuff. And this one is monthly calendar planning. So this one is actually giving them a scenario. So you're planning a winter party and you're giving them several things that they have to mark on the calendar and follow through. So again, executive functioning skills. And then here's some other sequencing. So they're given all these steps and then they have to order them. And the last part of my on-call notebook are prevention articles. So the first one I have is the determinants of dropout and non-adherence in a dementia prevention randomized controlled trial. The prevention of dementia by intensive vascular care trial. So the article said that older age, poorer cognitive functions, more symptoms of depression, and greater disability were the most important determinants of dropout of older people. The presence of cardiovascular risk factors was not associated with dropout, but was associated with non-adherence. And being overweight was a risk factor for non-adherence. And then it goes on to say a few other things. So basically, they determined several factors that were associated with the dropout, and these findings can help guide the future of dementia prevention in trials with older adults. This one was using the public health model to address the unintentional injuries of TBI. So this one is really, so this one had some really good info about TBI and the CDC. And the CDC actually developed STEADY, which is an initiative to help primary care providers identify their patients' fall risk and provide effective interventions. So that's pretty neat. This study talked about how TBI is a major cause of mortality and disability. And they said that basically to treat it, the effort to understand TBI and available strategies is to treat this lesion in order to improve clinical outcomes after TBI, and may be based on an increase in research on the epidemiology of TBI. This one is the Alzheimer's disease prevention, and this one summarized ongoing clinical trials of recruiting patients with preclinical AD or a higher risk of onset of AD-related cognitive impairments. So they looked at all these primary prevention strategies. And they're saying by delaying the onset of Alzheimer's dementia for only a few years, it would have a huge impact on public health. This one is risk reduction in the clinical practice of Alzheimer's disease prevention. And this one goes through and explains about Alzheimer's disease and what research and what they're doing out there to prevent Alzheimer's. So that is the end of my on-call notebook.